Seniors, those with heart disease and other chronic conditions, the most vulnerable. We have to do everything we can to protect them. And that's a message that Coastal Hospice is taking very, very seriously. With more on changes made in response to the COVID-19 pandemic is Elaine Kappen. She is the president of Coastal Hospice. Thank you for being here this afternoon.
Hi, thank you for having us come on.
So obviously you're committed to keeping patients, staff, everyone safe. So what are some new protocols?
So all of our staff are self-monitoring, and we are not allowing anyone who is sick or has traveled by airplane to visit patients for 14 days until after they're clear. We are doing a lot of education for our families too. It's a very important time where normally families would all come into town and be, hugging and supporting each other, and we're having to tell people to take a step back.
Yeah.
We are providing these RAC cards for all of our families and our staff to help give them a tool so that they can say, hey, look, Coastal Hospice told us if you've traveled within 14 days or if you have symptoms of a respiratory infection, you should not come and visit our loved one. Mm-hmm. We also want people to know that it is not rude to tell your visitor when they do come in, please go straight to the bathroom and wash your hands. Mm-hmm. That is a good, safe practice.
Sure.
And we are advising families to limit the visitors to their loved one to the people that matter most. Immediate family, the best friend, but this is not the time for, the cousin to fly in from Arizona.
Sure.
This is the time to be very safe and careful.
Yeah. What about social distancing when you do visit?
We are all practicing social distancing, mm-hmm. including our staff. Chaplains and social workers are doing telephone visits with some of our families as well, mm-hmm. To minimize the number of people coming and going. Although not everybody, some patients still want them in person. So
sure.
We are practicing social distancing all the time. Now, of course, nurses, that's a hands-on function.
Right.
AIDS is still a hands-on function, and we are still doing that. We've had no interruption in our business at this point.
What are you hearing from the patients? How are they taking this?
Anxiety.
Yeah.
Our chaplains were telling me the other day that the patients still want them to come in person, but when they come, the thing they want to talk about is the virus and their anxiety about the virus. So there's a lot of uncertainty, mm-hmm. and hospice, somebody coming onto hospice is a very tense and anxious time by itself. And then you add this, which is kind of like a cloud hanging over.
Sure.
And families are under more stress. And stress also lowers your immunity. So it's even more important that they protect themselves with hand washing and sanitizing surfaces, and mm-hmm. making sure their visitors do the same.
Now, even with all of this going on, the mission of Coastal Hospice remains the same?
It does remain the same, to provide dignity and comfort to patients and families with life-threatening illnesses.
Yeah. Is there anything that we as a community, our viewers, can do to help support you with this at this time?
Wow. Donations still, mm-hmm. because our main fundraiser for the spring has been canceled or rescheduled for October. Sure. So Stansel House is dependent on some of those fundraisers. Mm-hmm. And again, just everybody being responsible to follow hand washing, sanitizing, limiting visitors, not allowing people who are sick to come around people who are healthy.
All right, understandable. Elaine Kappen, President, Coastal Hospice, thank you so much for joining us.
Thank you for having me.